experienced the deadliest day of the pandemic so far. Nationwide, 3,775 lives were lost yesterday. That is more than 24 above the country's previous record that was set less than a week ago. The country is also seeing a record number of people hospitalized with the virus. More than 131,000 people are being treated. For more on this, let's bring in Dr. Neeta Ogden. She's an internal medicine specialist and immunologist. Dr. Ogden, good to see you. So earlier this week, thousands of Americans received their second dose of the coronavirus vaccine. Now, some are reporting side effects, including headaches, chills, fever, and fatigue. So I don't want to alarm people, but how can people tell the difference between experiencing side effects or possible infection? And are these side effects more pronounced on people who are at higher risk of severe infection, like perhaps minorities or people who are older?
Good morning. And I'm glad we're bringing up side effects, because I think it's so important to continue to have active discussions about what are side effects, so that people don't have undue alarm or are more hesitant to take the vaccine when they can get it. And the side effects that you have mentioned, they're very typical of the coronavirus vaccine, and we're pretty much hearing them across the board. They were mentioned in the data analysis by the FDA for both mRNA vaccines, and they're really a sign of the immune system kicking into effect and doing what it's supposed to do. Now, if somebody's worried that they could potentially have a COVID-19 infection as well, that really depends on something called your, sort of pre-test probability. What's the likelihood? What have you been doing? Where do you work? Think about your true risk of exposure before jumping to that conclusion, and ultimately putting those things together, like a clinical history along with some sort of testing, can allay that fear. But I would say that those side effects, the fever, the headache, malaise, chills, they're very, very typical and normal of the vaccine. People shouldn't be alarmed. I haven't heard of them being more extreme in any minority populations, but it varies from person to person. It's important to stay in touch with your healthcare provider. I think doctors, primary care providers in the office setting are hugely vital here. I'm fielding tons of questions about vaccines and allergies, and it's up to us really to talk to our patients at length and really get rid of any kind of, just mythology or feeling that they have concerns. Actually, it's very much out in the media, and it's important to continue these discussions.
Do we know if the possibility of side effects, if they're any different depending on the vaccine that you get, whether it's the Pfizer, BioNTech one or the Moderna one? And I know that, and man, I know you're probably going to finger wag me, but I am not one of those people that typically gets the flu vaccine. I know Vlad is religious about it. Occasionally I hear people say that they've had side effects from the flu vaccine. Are we talking about something that's very similar, or is it different?
I think it's very similar, and I'm hearing that the side effects to the vaccines are pretty much the same. I'm not hearing that anything is, stronger for Pfizer versus Moderna or vice versa. And I think that's a very, common correlate to the flu vaccine. We tend to get that sore arm after a flu vaccine, and I haven't seen the sort of fever, headache, and more systemic stuff that we're seeing with the COVID vaccine as much in the flu vaccine. But I think it's just the same line of thinking. This is your immune system kicking in and doing what it's supposed to do. And that's why you get these few symptoms that tend to last, 48 hours. And, to speak to the other point you made about whether it could be an actual coronavirus infection, those symptoms would probably last longer. The vaccine side effects are pretty self-limited.
At least 2 members of Congress have tested positive for COVID-19. Their diagnosis comes after they were both jabbed with the first round of the coronavirus vaccine. So how is that possible?
It's possible. It's definitely possible. And I think it's just, again, so important not to run away with these kinds of stories and say that the vaccine doesn't work. We know that it takes time for the immunity from the vaccine to kick in, at least 10 to 14 days after that first dose. And this is obviously a topic that's raging in the news right now, is how much protection do you get and for how long? So, if you were exposed to the coronavirus and then you get vaccinated and then you develop coronavirus infection, that's an expected thing to have happen. The vaccine's not going to protect you that quickly. So I'm not alarmed, and I think we need to just sort of be thoughtful about how the immune system works. It takes days after that first dose, and then even the same amount after that second booster dose for us to see really that high level of efficacy that we've seen reported.
Several state governors have actually been critical about just how the vaccine is being administered. In Maryland, only 34% of more than 163,000 doses sent to hospitals had been administered. I'm wondering, what your take on this is. I feel like, even as us, as journalists, we'll say, listen, the rollout is really, really slow. And then kind of on the flip side, we're talking about how overwhelmed hospitals are with all the COVID patients that are coming in. And I know there are probably logistical reasons as to why the same place you go when you're very sick is also the same place you go to get the vaccine. But I'm wondering if you think that that's, putting a lot of pressure on hospitals right now.
Oh my God, 100% it is. And I think this highlights what we saw with testing and COVID-19 in general. There has not been a national strategy. I'm alarmed by how the vaccine rollout doesn't have more of a standardized system in place. And everything's been left to these states that are already strapped in dealing with surges in hospitals. It's just simply too much. And this also coincided with, the holidays and staffing shortages. So, and it's being a novel vaccine and everything involved with storage and distribution. So you can see how the vaccine would very quickly roll out, would very quickly slow down. Now, I've read just yesterday that the director of the immunization arm of the CDC said that there's going to be a massive rollout in the next few weeks, again, post-holiday and all of that we should see a lot more people getting the vaccine. But I think it would really be great if we had a standardized system to help these states, a website where people could, go by zip code and learn what group are they in and when is that group rolling out. I know that the Governor Cuomo said that now it's time to start moving the vaccine administration to, more places than hospitals, like, firehouses and police stations. We just want to get as many people vaccinated as possible in a timely fashion and also within the frames of those groups, but also to start moving quickly through group 1A, B, and C, because you can't wait for people who might be reluctant or for other reasons. So the whole thing feels kind of like a mess, unfortunately, and I really do hope that we see a change in the next few weeks, since there has been so much sort of notice given to the inefficiency of this rollout.
All right, Dr. Neeta Ogden, thank you so much.
Thank you for having me.